Chronic cough is common, debilitating, often difficult to treat, and can persist for years or decades as patients cycle through repetitive clinical workups without effective treatment. Cough is a frequent reason for seeking outpatient medical attention in the United States, often leading to special referrals and high economic impact. The economic implications of chronic cough include the cost of outpatient visits, plus diagnostic workups, prescription medications to treat cough, and lost work and lost school productivity. NetCE's Chronic Cough CME course can help identify common causes and risk factors, leading to more effective treatment. Risk factors of chronic cough include smoking, older age, obesity, asthma, allergic rhinitis, rhinosinusitis, and angiotensin-converting enzyme, ACE inhibitor use for hypertension treatment. Women may also be at higher risk of chronic cough. In addition to identifying risk factors, understanding underlying common causes for chronic cough leads to more effective treatment. The most common underlying conditions include asthma, COPD, non-asthmatic eosinophilic bronchitis, upper airway cough syndrome, and GERD. NetCE's course, Chronic Cough in Adults, dives deeper into these risks and underlying causes, helping you care better for patients. Describe the background and terminology related to chronic cough. Compare and contrast available cough severity measures. Outline the epidemiology of chronic cough and underlying etiologies. Evaluate the impact of chronic cough on various dimensions of patients' lives, and much more. Explore causes of chronic cough continuing medical education at netce.com.